தபோவன இணையதளத்தில் இணைந்துள்ள அனைவருக்கும் மனுஷியாவின் மாலை நேர பணிவான வணக்கங்கள். ஞாயிற்றுக்கிழமை தோறும் நமது தபோவன கலை நிகழ்ச்சிகளை நாம் எல்லோரும் கூடி நடத்த முடியாத காரணத்தால் இந்த இணையதளம் ஜூம் நமக்கு ஒரு வரப்பிரசாதமாக அமைந்துள்ளது.
Ladies and gentlemen, welcome to a weekly show, Zoom show today, 6 June 2021. எப்படி இருக்கீங்க எல்லாரும்? எப்படி இருக்க முடியும்? பேண்டமிக் டைம், லாக்டவுன், போராது பிளாக் ஃபங்கஸ் வேற ஆரம்பிச்சு கஷ்டப்படுத்தின்னு இருக்கு. இதுல எப்படி நம்ம காப்பாத்திப்போம்? ஹவு டு சேவ் அவர் செல்ஃப், ஹவு டு வாட் கைண்ட் ஆஃப் லைஃப் ஸ்டைல் வி ஷுட் லீவ். இதை பத்தி பேசுறதுக்கு நம்ம கூட இன்னைக்கு இருக்கா ஸ்பெஷல் கெஸ்ட் ஸ்பீக்கர் டாக்டர் ரிபப்ளிகா, palliative expert. இன்னைக்கு ப்ரோக்ராம் first we'll have a prayer by Anusuya, followed by introduction of the speaker by Mr. Varadarajan. Then the speaker takes over, guest speaker takes over, at the end of which we'll have a question answer session. And finally, we wrap up with a vote of thanks to be proposed by Secretary Tapovan, Mr. Subramanian. Okay, ladies and gentlemen, let's get cracking. First up, prayer by Anusuya. Anusuya, go ahead.
சரணம் சரணம் கணபதியே, சக்தியின் மைந்தா கணபதியே. சரணம் சரணம் கணபதியே, சக்தியின் மைந்தா கணபதியே. வரணம் வரணம் கணபதியே, வந்தே அருள்வாய் கணபதியே. வரணம் வரணம் கணபதியே, வந்தே அருள்வாய் கணபதியே. அன்பே சிவமே கணபதியே, அருளும் தருவாய் கணபதியே. அன்பே சிவமே கணபதியே, அருளும் தருவாய் கணபதியே. இல்லல் நீக்கும் கணபதியே, இன்ப ஜோதியே கணபதியே. இல்லல் நீக்கும் கணபதியே, இன்ப ஜோதியே கணபதியே. கண்ணே மணியே கணபதியே, கவலைகள் நீக்கும் கணபதியே. கண்ணே மணியே.
Hello, Anusuya. Thank you very much for your prayer. Very good rendition. We need to invoke the gods and goddesses during these travel times. Now, next we go on to have the introduction of the guest speaker, Dr. Republica. I would request Mr. Varadarajan to introduce her, please. Mr. Varadarajan, please come on.
எல்லாருக்கும் மாலை வணக்கம். இந்த வழக்கமா சண்டே இன்னைக்கு நடக்கக்கூடிய இந்த ப்ரோக்ராம்ல இன்னைக்கு டாக்டர் ரிபப்ளிகா ஸ்ரீதர், MBBS, FCCF, PGDFH அப்படிங்கிறவ இன்னைக்கு இந்த தேதியில இந்த COVID-19 பொறுத்த மட்டும் ப்ராப்ளம் நிறைய இருக்கிறதுனால அது சம்பந்தமா ஹைலைட் பண்ணி பேசுறதுக்காக இருக்காங்க. அந்த டாக்டர் ரிபப்ளிகா பத்தி நான் இப்போ இன்ட்ரோடியூஸ் பண்ணிக்கிறேன். அண்ட் எல்லாருக்குமே அவளை பத்தி என்ன தெரியும்னாக்கா, she is a family and palliative care physician, and she has got her medical graduation in 1992 from Sri Ramachandra University, and after her graduation she is the founder director for RMT Nursing Home in T Nagar. It is having 25 beds and it is running for more than 25 years. And her will to serve the humanity has given her the opportunity to interact with various organizations like AIMS Kochi 2005. She could get some course over that. பிளிண்டர்ஸ் யூனிவர்சிட்டி ஆஸ்திரேலியா, சங்கர் நேத்ராலயா, இந்த மாதிரியான பெரிய மெடிக்கல் இன்ஸ்டிடியூஷன்ஸ் கூட எல்லாம் வந்து அவ இன்டராக்ட் பண்ணிட்டு இருக்கா. ஃபார் தி பாஸ்ட் 8 years her specialization is in palliative care, and her special hospital for palliative care is in Chennai, Sri Perumbudur and Madurai. Chennai itself, 4 branches of this palliative RMD hospital is there, and all these hospitals put together is having 120 beds, and she is the founder of RMD Academy of Health. And her for the specialization in palliative care and other things, she has got training and education care. And the முக்கியமா என்னன்னாக்க வந்து இது வந்து ரூரல் ஓரியன்டட் திங்ஸ் பண்ணாதான் திங்ஸ் வில் பி சம்வாட் வெரி மச் ஹெல்ப்ஃபுல்லா இருக்க முடியும். ஆகையினால என்னன்னாக்க இது வந்து என்ன ஆயிடுது சொல்லியாச்சுன்னாக்க ரூரல் விமனுக்கு ட்ரைனிங் கொடுக்கக்கூடியது இந்த RMD அகாடமி ஆஃப் ஹெல்த்தினுடைய ஒரு முக்கியமான அப்ஜெக்டிவா வச்சு பண்ணிட்டு இருக்கிறதுனால அங்க வந்து அவளுடைய சர்வீசஸ் எங்கெல்லாம் போறதுனாக்க கேன்சர் அவேர்னஸ், ஆன்டி டிபோக்கோ மூவ்மெண்ட், palliative and hospital care awareness, HIV awareness, pink movement, pink movement, women health corporate awareness, and various education institutions like Loyola College, Vaishnav College, and so on. And she is the consultant for the magazines like what is called Aval Vigadan, and mainly Lady Special, and also Dinagaran. And she is a call consultant. One can call her over phone and then talk to her, and she will give the consultancy. And in this COVID period, it is very much important because all the persons are not able to go to hospital and get the specific consultancy for the care, particularly with respect to elderly people. This consultancy is more important. And அந்த இதனால கால் கன்சென்டர் எங்கெங்கெல்லாம் இருக்கா சொன்னாங்க, அடையார் கேன்சர் இன்ஸ்டிடியூட், SRMC Sri Ramachandra Medical Institute, Vijaya Hospital, and so on. She is a member in various institutions. I am mentioning only a few. International Hospice Care and Magalir Puduvalvu Thittam, and she is the secretary for Chennai Association for Palliative Care. She is the faculty in various medical organizations also. I am mentioning again a few only. She is SRMC Sri Ramachandra Medical Center, Orur. She is then Indian Association Palliative Care, National Skill Development Course, adukku idla palliative care irundha. She is having more than 17 awards. முக்கியமா 4-5 awards மாத்திரம் சொல்றேன். ராஜீவ் காந்தி எக்ஸலன்ஸ் அவார்ட் ஃபார் அவுட்ஸ்டாண்டிங் அச்சீவ்மெண்ட், ஜஸ்டிஸ் டாக்டர் KS சஞ்சீவி அவார்ட் ஹோம் கேர் அண்ட் எல்டர்லி பேஷன்ஸ் அண்ட் கேர் சர்வீஸ். முக்கியமா இந்த டேட்ல சொல்ல வேண்டிய அவார்டு என்ன சொன்னா, SIWAA 2020 award, Shiva Award for COVID barrier. She is fighting against the COVID now. And then to mention about her family, she is the daughter of Sri R.M. Dave, ex-Sharif of Madras, and she is the wife of Sri Sridharan, a financial consultant, actor, and businessman. Both this Sridhar and Republica are blessed with one daughter doing a 10th standard studies. And today's topic is mainly oriented towards the how to take care of ourselves in fighting against COVID. And now I request Dr. Republica to share all her.
Now the stage is all yours, Dr. Republica. Please go on.
Thank you Tapovan team. எல்லாருக்கும் நமஸ்காரம். And it's a wonderful opportunity. என்ன அப்படின்னா ரொம்ப crucial-ஆன period. Just for few, my name is Republica because I was born on Republic Day. My dad was a Sharif of Madras, and being a freedom fighter, because I was born on Republic Day, he felt he has to name me Republica. So that is for people who have an exclamation about my name. And I definitely thank Mr. TRS sir and the entire Tapovan team to give this opportunity, because it's, as I said, it's a very, very crucial period, particularly for elders, because the second wave is completely different than the first wave. So that is what I would going to highlight today, that it need not be particular symptoms, but it's a combination of symptoms which we should be sensitive about and how to overcome it. And I would just start off telling that you people are blessed because your environment which you're staying has enough of oxygen. I'll start off with that, because the second wave compared to the first wave typically attacked the upper respiratory system, and So the first wave, there was upper respiratory infection, அதாவது மூக்கு தொண்டை வாய் ஒரு நார்மல் ஃப்ளூ மாதிரி இருந்தது. So அதுக்கப்புறம் வந்து there were certain people who had some respiratory problem areas with the amount of oxygen is high. There is a lot of difference between the first wave and the second wave. First wavelet was more on the upper respiratory infection and normal flu மாதிரி இருந்தது. சில பேருக்கு it caused a lot of breathing difficulty, but it did not go into a major setback in terms of health. Second wave la the mutation of the virus is in a very different form where it attacks in different ways. So the common things which came is normally or flu madri varadudha, but it was sudden. It did not give that 3 to 4 days incubation. Now I just want y'all to be very clear. Today I get exposed to a particular person or a area with COVID. People should not think nethu na COVID area pona I immediately get. The incubation period is 20 to 25 days. So when I get exposed to that COVID, நமக்கு வந்து 20-25 நாள் ஆறுது அந்த இன்ஃபெக்ஷன் வந்து நமக்கு அட்டாக் பண்றதுக்கு. So on the 20 days, that is 15 to 20 days குள்ள, if I have that immunity, then the infection will not attack me. அது அப்படியே வந்துட்டு என் பாடியில இருக்கிற antibodies will take this out from the body. But when after 25 days, if my immunity is little, it need not be that immunity is very, very low for everybody. But even if there is a little bit of difference, that itself can cause an attack, and it can cause a damage in terms of bringing down the infection to a large extent, depending on the person's physiology. இதுதான் நீங்க புரிய வேண்டிய விஷயம். எல்லாரும் என்ன நினைக்கிறேன், எனக்கு ஜுரம் வரல, எனக்கு ஒண்ணும் வரல அப்படின்ட்டு. பட் இப்ப செகண்ட் வேவ் பொறுத்த வரைக்கும் எப்படின்னா, சில பேருக்கு தலைவலி மாதிரி மட்டும் வருது, சில பேருக்கு மயக்கம் மட்டும் வருது, திடீர்னு மயக்கம், திடீர்னு டயர்ட்னஸ். ஃபார் சம் பீப்புள் தேர் இஸ் டயரியா. ஸோ டயரியா நார்மலா போடுற நம்ம லோப்ரமைடு அதெல்லாம் கூட நிக்கிறது இல்ல. ஸோ தட் இஸ் ஒன் மோர் சிம்டம்ஸ் விச் வி ஹாவ் டு லுக் ஃபார். ஸோ எவ்ரி சிம்டம்ஸ், வாட் ஐ வுட் சே இஸ், இஃப் த சிம்டம் இஸ் பர்சிஸ்டிங் பியாண்ட் 2 days or 2-3 days, ப்ளீஸ் டோன்ட் வெயிட். நான் இது சாப்பிட்டுட்டேன் அதனால எனக்கு வயிறு சரியில்லை அப்படின்ற மாதிரி நம்ம இக்னோர் பண்ண வேண்டிய அவசியம் இல்லை. அதே மாதிரி எனக்கு தூக்கம் சரியில்லை, நான் பிபி எல்லாம் பார்த்துட்டேன், என்ன நன்னா இருக்கு, இதனால எனக்கு தலைவலி வருதுன்னு இக்னோர் பண்ண வேண்டாம். ஸோ 3 to 4 days பாருங்க. 3 to 4 daysல எந்த ஒரு சிம்டம், ஸோ லெட் இட் பி காஃப், கோல்ட், லெட் இட் பி ஃபீவர், let it be diarrhea, let it be giddiness. If it is persisting, then other than what you normally think, also think of COVID. இது நான் பயந்து நீங்க பண்ண வேண்டிய அவசியம் இல்லை. ஏன்னா ஃபர்ஸ்ட் திங், மை humble request, please don't look at the TV, please don't look at the statistics, because இது என்ன அப்படின்னா, the more you keep talking, everybody gets scared about the whole thing. And that is one thing which I definitely would avoid you people. Yes, we need to know what is the level, கேளுங்கோ, but let it not repeatedly run. And when you people are in an environment where you can divert yourself, you're not like so many other elders who are sitting inside alone, helpless and all that. You all are a team, so that way it is a very, very conducive environment that you people can exchange viewpoints, have a lot of transparent talking. So that itself will give you a lot of sense of relief. So the immunity level, what do I mean by immunity? So when there is an infection in the body, there are certain group, நம்ம lymphocytes சொல்லுவோம் இல்லையா, நெறி கட்டிக்கிறது இல்லையா, அது that comes and attacks anything and gets it out of the body. Now for people who are diabetic, people who are already immunity low need not be a titer. நீங்க எல்லாரும் நினைக்கிறேன் இது நன்னா இருக்கு அது நன்னா இருக்கு. It's not like that. It's like a body reaction. When suddenly my immune system collapses, it's like a security system. When that collapses, the enemy, which is like the COVID, will take over the body. That's exactly what is happening. Second way, why this oxygen became a big issue is because the particular virus strain this time started creating thickness in terms of secretions, in terms of circulation. This was a big surprise which we were not prepared. The medical fraternity did not expect it to suddenly impact this way. So இப்போ இருக்கிற ப்ரோட்டோகால் பார்த்தீங்கன்னா, நார்மலா இருக்கிற பிளட் டெஸ்ட் எல்லாம் கூட there is something called COVID profile. ஸோ உங்களுக்கு அந்த சந்தேகம் இருக்கு, எனக்கு வந்து ஃபீவர் அந்த மாதிரி இருக்கு அப்படின்னா, ஆர்டிபிசிஆர் டெஸ்ட் தவிர யூ ஹாவ் டு லுக் ஃபார் சர்டன் COVID profile blood test, which is called D dimer, LDH அப்படின்னு. இது என்ன சொல்றது அப்படின்னா, you are at risk that your blood is thick. You are at risk that your immune system is triggered to a larger extent. So this titer will give me a fair enough guidance to how much I should immediately intervene and look after. This is completely on the doctor's perspective. So you people need not get alarmed. Again, I repeat, any symptom, whatever may be the symptom, normal 2 to 3 days, if you all are not becoming all right, please think of it could be COVID. Like any other diagnosis, look at it. Diabetic people need not get scared. What you should be very careful is maintain your HB1A1 C under 7. 7 ku keela vechelna we are safe. So that is one titer which you maintain it. Second thing, stress. Please remove whatever are the stress. Please remove the stress. We are lonely. What if something happens? Nothing is going to happen. This second wave has clearly showed that there is no category that elders ku dhaan varum appdinu illa. So many middle-aged people also had. It also came like heart attack. So that, let us be clear. So I don't want you all to have a fear that, you know, it will come, and if it comes and I'm a diabetic, I don't want that, because that definitely will interfere with your immune system. You will have. So simple tips what I tell is, நீங்க நார்மலா போற வாக்கிங்ல ஒரு படபடப்பு இருக்கு, ஒரு பல்ஸ் ரேட் உங்களுக்கு அதிகமா இருக்கிற மாதிரி இருக்கு, கொஞ்சம் டைஜஸ்டிவ் ஃபுட் கொஞ்சம் சரியில்லை அப்படின்னா, just keep a watch on your body. It need not say that you are having the infection. Keep a watch. Definitely all of us will be aware. If something is changing in our body, we will be aware this is what is wrong. Food plays a very, very, very important role for immune development. Now, what are the foods? People might ask. I would put it in a very simple way. Gastric problem irukravanga citric fruit சாப்பிடாதீங்க. Actually, citric fruit is very good. It is very good to immune system because vitamin C citrus fruitல எல்லாம் இருக்கு. ஆம்லா, சாத்துக்குடி, முசம்பி, கமலா ஆரஞ்சு அதெல்லாம் இருக்கு. பட் அசிடிட்டி இருக்கிறவா அதை அவாய்ட் பண்ணிருக்கோம். நீங்க என்ன ஒரு பக்கம் வைட்டமின் சி சாப்பிட்றேன்னா, ஐ டோன்ட் வாண்ட் யுவர் கட் டு கெட் இன்ஃபெக்டட் ஆர் இரிட்டேட். ஸோ தட் இஸ் ஒன் திங். People who are having borderline kidney. Now again, when I mean kidney, it need not be my urea creatinine is normal, I am okay. Not like that. People who are prolonged BP tablets, diabetic medicines, எடுத்துட்டு இருக்கிறவா, just keep a watch. Don't take too much of salt. High protein diet, because that can, you know, kind of load the kidney. And the other aspects is, do not take too much of heavy food. நான் நல்லது சாப்பிட்றேன், ஆர்கானிக் சாப்பிட்றேன், நான் வந்து நிறைய பயறு அதெல்லாம் சாப்பிட்றேன்னு டெய்லி ரொட்டீனா வச்சுக்க கூடாது. ஸோ ரீனல் ப்ராப்ளம்ஸ் இருக்கிறவா, திஸ் இஸ் ஃபார் த ஜெனரல் ஹெல்த் ஐ எம் ஆல்சோ டாக்கிங். ஸோ ப்ளீஸ் see that whatever you're taking should be balanced for your particular physiology. That is very, very important. Yes, there are so many foods when they are telling in WhatsApp and other things, this is good, that is good and all that. Overall, what is truly, truly good, particularly during COVID time? Any of the detox. Now, what do I mean by detox? Nama body la any time there is a bacteria or there is a reaction in the body, there are a lot of toxins and the cell vodanje adu mooliyama there are a lot of unwanted chemical reactions that has to get washed out. How does it get washed out? By drinking a lot of water. Let's start with simple thing. So people who can get up in the morning, have normally people say 1 liter of water, but people who are prone for kidney don't take 1 liter of water. I would recommend 1 to 2 glasses of water early morning, empty stomach. Food with honey, ginger and lime has been proven that it definitely builds the immunity, improves the digestion, and also is a good detox. So you can keep this as a routine. You can also have it as a green tea with little bit of lemon and honey in the mid morning, between 11 and 12. அதையும் நான் சொல்றேன், அது ரொம்பவே வந்து நிறைய சாப்பிடக்கூடாது. நிறைய பேர் வந்து 2-3 டைம்ஸ்லாம் சாப்பிட்றா. Avoid it, because that can increase your pitta. Your gallbladder can get irritated. So have a balance of that. So good foods are, yes, good protein, but see that you are able to digest the protein. Enough of detox liquids can be good. People who are having gut issues, வந்து stomach வந்து சரியா இல்ல, maybe you have constipation, or maybe you feel you're not digested, aloe vera is very, very good. By naturally, aloe vera is good. The other very good thing for respiratory, வந்து நமக்கு எல்லாருக்கும் தெரிஞ்சதுதான் ஆடாதோட இலை, because this is all proven. I'm not talking out of the box. This has been proven that these things are really good. You can have ஆடாதோட இலை, tulasi, இந்த மாதிரி things. You have it like kashayam, or you have it as a tirtham. Just boil it a little bit and take it. So tulasi is very good. It has been proven that these things will take off your respiratory secretions. ஓமவல்லி இலைன்னு சொல்வா, அந்த மாதிரி you can have concoctions. So இது வந்து in between midday meal இல்ல evening before tea or instead of tea, you can have a drink like this, a concoction like that, so that any secretions which is getting stuck to your system can go down. So this is all natural things which you can do at home. எல்லாருக்கும் தெரிஞ்சதுதான். luckily நம்ம இதுல வந்து we take a lot of curd, so it is good. ஏன்னா curd becomes a very good probiotic. It also removes a lot of toxins. Again, people who take lot of curd, be careful if you have cholesterol or if you have gallbladder issues. It is better you have buttermilk than curd. So this is one thing which you have to watch. People who are having arthritis, if you people are having already multiple drugs, இப்போ நிறைய drugs வந்து arthritis கொடுக்குறா, அந்த bone வந்து strengthen ஆறதுக்கு. அதுலயே சில drugs பாத்தீங்கன்னா it is already immune compromising medication. அந்த மாதிரி இருக்கிறவா வந்து please review with your doctor what are the medications which you are having, whether at this particular period you need to take so much of dose or can we reduce it somewhere here and there. இப்போ current COVID situationல the other alarming thing is D-dimer. D-dimer in test எடுத்துட்டா, if it is increased, it shows your blood is thick. So what do I do then? I start giving you antiplatelet medicines which will reduce the thickness of the blood. So அந்த medicines போடணுமா? அது நீங்க நிறைய பேர் பார்த்தேன்னா already heart problem இருக்கிறவா already நீங்க எடுத்திருப்பீங்க, நீங்க கேள்விப்பட்டிருப்பீங்க இல்லையா, ஈகோஸ்போரின், platelet, blood thinning medicines சொல்லுவோம் லோக்கலா. அந்த மாதிரி எடுத்துட்டு இருக்கிறவா, if you go or if you land up to a doctor, please inform the doctor I'm already taking this medicine. என்ன ஆயிடுறது, நிறைய இடத்துல பிளைண்டா வந்து the doctor gives antiplatelet, you are already taking antiplatelet, then you land up with some gastrointestinal bleeding or loose motions அந்த மாதிரி. Now coming to the particular fungus which is scaring everybody, let me be honest, this fungus was always present. It is becoming high because COVID time there is a little bit of use of steroids. Now steroids use பண்ண கூடாதா, ஏன் யூஸ் பண்றா அப்படின்ற டவுட் உங்களுக்கு வரலாம். இந்த இம்யூன் சிஸ்டம் ட்ரிகர் ஆயிடுச்சு, அதாவது எனிமி வந்து பாடி அட்டாக் பண்ணி ரியாக்ஷன் ஆகும் போது, நான் சொன்னேன் இல்லைங்களா டாக்ஸின்ஸ் எல்லாம் வெளியில வரும்னு, அந்த டாக்ஸின்ஸ் வெளியில வர்றது நச்சு பொருள் ஒண்ணு, we are going to flush it out of the body. பட் அது வந்து எல்லா ஆர்கன்ஸும் அட்டாக் பண்ணாம பண்றதுக்கு நான் என்ன பண்ண முடியும், I can only put a steroid. That is the option. So when the immune is triggered, I have to put a steroid so that it does not cause a major reaction in the body, particularly even in the lungs, because when I put a steroid, the lung becomes relaxed. நீங்க நிறைய வீசிங் இருக்கிறவா கேள்விப்பட்டிருப்பீங்க, நான் நெபுலைசர்ல வந்து பியூட்டி காட் அதெல்லாம் வைக்கிறேன், that's all topical steroids. So when I give medicines like that, that will reduce the reaction or the immune trigger system, make it little calm. But என்ன ஆறுது, for people who are diabetic, for whom already the body steroid level will be high, we call it cortisol, cortisol. Cortisol level நிறைய இருக்கிறவா, people who are fat, people who are taking lot of fatty food, people who are taking lot of sweets, people who are diabetic, இவாளுக்கு ஆல்ரெடி cortisol level பாடியில கொஞ்சம் ஜாஸ்தி இருக்கும். இந்த மாதிரி இருக்கிறவாளுக்கு when you start giving steroids, we have to be careful that this does not trigger their immune system down. It's simple. நான் வந்து என் பாடிக்கு வந்து வந்த எனிமியை அட்டாக் பண்றேன்னு நான் அட்டாக் பண்ணிட்டு ஸ்டீராய்ட்ஸ் போட 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 அந்த ஸ்டீராய்டே எனிமி ஆயிடும். நான் சொல்றது புரியும்னு நான் நினைக்கிறேன். நம்ம எனிமி எடுக்கிறது விஷயம், ஃபார் எக்ஸாம்பிள் என் ஆத்துல திருடம் வரான்னு நான் ஒரு செக்யூரிட்டியை வைக்கிறேன், ஆனா அந்த செக்யூரிட்டியே நாளைக்கு வந்து என் வீட்டுக்கு வந்து ஆபத்து ஆயிடுறான், அதுன்றதுதான் இந்த ஸ்டீராய்டோட நிலைமை. சோ இந்த ஸ்டீராய்டு நமக்கு தேவை, பட் அதுக்குன்னு ஒரு வரம்பு இருக்கு, இவ்வளவுதான் நம்ம யூஸ் பண்ண முடியும் அப்படின்றது பார்த்துட்டு உங்க பாடிக்கு what is important, that obviously the doctor is going to decide. So people who are having diabetes, be little extra careful, need not get worried. Now how do I avoid this mucormycosis? When you're using a mask, If it is all the other disposable mask, please dispose it on that day. Actual time is 4 to 5 hours. அதுக்கு மேல அதை போடக்கூடாது, தூக்கி போட்டுடுங்க. துணியில போட்டிருக்கவா டெஃபினட்டா அலசிட்டு see that you are able to breathe. அந்த breathing இல்லாத, right? So that moisture itself attracts lot of fungal infection. 1. 2, இந்த மாதிரி steroids போடுறச்ச because your immune is completely down, shut off, like COVID, the mucormycosis also comes in. It's one more enemy which comes to attack. So in terms of symptoms, don't get worried. If you're having irritation, if there is thickness, if you feel mucormycosis is very typical. It'll be a tip black or a white color, coat on your particular nose, either the eye or the mouth. Now, I don't want you people to get very alarmed because hygiene nalla irukkiradhu, dry weather illama, if you have a lot of steam, we can avoid it to a large extent. What we have to be careful is your cortisol level. Cortisol level high irukku. So இப்போ என்ன பண்ண ஆரம்பிச்சிருக்கா இந்த present trendல, as we are seeing D-dimer, LDH, C-reactive protein, we are also checking for cortisol levels so that நான் தைரியமா ஸ்டீராய்டு கொடுக்கணும் அப்படின்றது இப்போ present protocolல டாக்டர்ஸ் அதை பார்த்துட்டு இருக்கோம். So cortisol level high இருந்தா then we are careful on use of steroids. So this is what it is. The main thing which we have to be careful is 3 things. Sudden giddiness, be careful. Don't think it is just because I didn't sleep or maybe today my BP had gone up, gone down. Because we are seeing a lot of elders who just have no other symptoms, but just giddiness and some 1 or 2 have even fallen. So don't ignore any symptom. This is what I would say. So in terms of food, please eat whatever you're normally eating. Idukkaga onnu extra nama maathika venda. But as I said, what can be an immune booster, please take it. Neem has been proven. There are a lot of neem preparations, like, if there is a syrup called PAT, and the madri you can take something because neem is a good antiviral. Now, what I need to take as a combination, I should take hot drinks. Okay, the hot drinks can have a detox. Detox na enna solra mari kashayam madri you can make something. So you can have a hot drink like a detox. You can have healthy food, protein, provided that protein is not too heavy for me to digest. It has to be only in the evenings before 6 o'clock. Don't have high protein food in the evenings. There is a lot of study about millet. These things are good and things like that. Millets are good. Again, have it more like a kanji, have it more like a chapati or a dosa, and avoid it in the nights. Have millets preferably before 6 or 7 in the evening so that you can digest the millets. Pazhaya kalathula they took millets, but they used to do that much of work, physical activity. They were able to digest that particular protein. Inda kalathula adu illa. In terms of exercises, you can start doing breathing exercises, which I'm sure all of you all will be doing. That can be any form. People who are practicing yoga, please do it because it definitely helps your airway system and your general circulation. What you should not do is sit in one place for a long time because the blood can become thicker for such people. People who are having already, in terms of loneliness or stress or whatever it is, take extra care. I think you should divert your mind and take extra care. You might, if there is a need, you can even go for counseling or check out with your neighbor what else can be done. That is one aspect. Third, yes, the next generation who are very much online, they have a different wavelength of thinking because we are seeing, now when the elders are I'm seeing. I have one party called Rukmani who's admitted. நாங்க வந்து அந்த பல்ஸ் ஆக்சிமீட்டர் போய் வச்சு பார்த்துட்டு இருக்கோம். பாட்டி had COVID, she's 95, but she's okay. Symptoms wise ஒன்னும் பெருசா தெரியல, but blood test எல்லாம் பயங்கரமா இருக்கு. So in fact yesterday she told, என்ன ஆவுன்னா ஏதோ ஒன்னு இந்த விரலை விட்டு பார்த்துட்டு இருக்கேன், இதுல என்னதான் உங்களுக்கு தெரியறது, என் உடம்புல இருக்கிறது இதுல என்ன உனக்கு தெரியறது அப்படின்னு திட்டினா. So it is very nice. She's bliss. She doesn't understand, but at the same time she's able to cope with the situation. So I think these things are good. You should know everything, but don't take too much into your head, because ultimately as a professional, what the doctors have to do, they will do it. But when we start replicating or thinking this is wrong, that is wrong, that panic I'm underlining, I'll use the word panic only. That panic is actually not very good. சரி, இப்ப என்ன நம்ம வந்து ப்ரிகாஷனா பண்ணிக்கணும் அப்படின்னா, நீங்க எல்லாம் ருட்டீன் பிளட் டெஸ்ட் பண்றேன் அப்படின்னா ப்ளீஸ் இன்க்ளூட் ஒன் சி ரியாக்டிவ் ப்ரோட்டீன். ஏன்னா நம்ம பாடியில இன்ஃபெக்ஷன் இருக்கா தெரியும். ஒரு டிசிடிசி கவுண்ட். மூணாவது, வேக்சினேஷன் தாராளமா போடலாம், provided you don't have fever, you are not exposed to any sort of surgery or any procedure for that matter. அந்த மாதிரி பாடி ஆல்ரெடி ஏதோ ஒரு ஸ்ட்ரெயின்ல இருந்ததுன்னா வேக்சின் போட்டுக்காதீங்க. இல்லாட்டி வேக்சின் தைரியமா போட்டுக்கலாம். அகெயின் வேக்சின் போடுறவா யூ கேன் டூ தட் டோட்டல் கவுண்ட், டிசிடிசி கவுண்ட், சி ரியாக்டிவ் ப்ரோட்டீன், see whether you're prone for some infection already. அந்த மாதிரி இருக்குன்னா வேக்சின் போட்டா you might have fever, you might have some reactions and things like that. Who are the people who should not put? People who are very old, people who have compromised already with the immune system, do not go near the vaccine. It's not going to make a big change at all. So people might tell you, take. What do I mean by immune system already bad? Romba high sugars, already kidney issues irukku, already COPD, lung issues irukku. That is, what is COPD is chronic obstructive pulmonary disease. Already my lung and heart are weak. And the mari people, please avoid vaccine. I don't think we are going to make a big difference with taking the vaccine, because that vaccine, as you're taking in the COVID inside, what is vaccination? Taking a low dose of COVID infection itself inside me. That should not cause as a big reaction. But if you're feeling fit, I have 101 disease, but I'm breathing well, I'm talking well, I'm walking well, I'm able to cope up, then please go ahead. But these are the people who are having vulnerability. I think it is avoidable, definitely avoidable. So let's not have that strict protocol. You ellarume podanum, naanu ivalu podanum அப்படின்றது பண்ணாதீங்க. People who are delirious, கொஞ்சம் altered sensorium ஓட இருக்கா, they are like they're not very clear, I would recommend do not put a vaccine unless there's someone to monitor them, because ஏதாவது reaction வந்தா கூட they'll not be in a position to tell what it is. So that is what it is. So I think all of us being educated, you people are definitely following all the protocol and all that stuff, but don't panic. It's like that cycle cannot be broken. Herd immunity is something which needs to be there. ஒரு இன்ஃபெக்ஷன் வந்தா எல்லாருக்கும் வந்துட்டு போறது is a herd immunity. The second wave was little different because of the circulatory issues and the blood thickness நால. அது நம்ம முதலே கண்டுபிடிச்சிட்டோம்னா I don't think we'll have a major problem. Most of them they say ஒன்னும் இல்ல அப்படின்ட்டு டக்குன்னு போய் people, if this present second wave, what we have to be very careful is the thickness of the blood. So any blood test which you all are seeing, just look for D dimer. And people who are already having other multiple issues, take one extra. That is one thing. And the other thing I definitely would like to know is understand each one's body is different. தூக்கம் இல்லாதவா, be careful. Urinary tract infection, elders, ladies particularly, because post menopause la irukradanaala you might have urine infection, you might not know you have that. Elder men, look for prostate infection, urinary infection. These things and all can aggravate the condition. Generally, these are the issues you all should be very careful.
Thank you very much, Doctor, for the excellent speech you gave us. Now we move into the question answer session. There are a few participants who would like to ask questions. The first one comes from Mr. Varadarajan.
Yes, sir.
Mr. Varadarajan comes with the first question, please.
Yes.
Good evening, Dr. Republica.
Very
nice to see you again. Kemcho.
Thank you.
Well, I'm going back to the same old question which we have discussed several times without success. But I think now it has become more important for us to look at having a geriatric care center and assisted living center here in Tapovan, because people are getting old. I'm also getting old. And the oldest person living here is 98 years young. And of course, having an assistant to look after. But what we are finding is that more and more people are falling into that category where they want care. Yes. And as an organization, we are not equipped to provide that care because it has to be done by a qualified medical specialist under a license, and the people who are providing the care can be either normal ayas who are trained to handle, or nurses who are, or a mix of them, and with a periodic visit by the doctor, especially under these trying times where everyone is scared about am I not safe. We we feel the need for this kind of a specific situation in the complex itself. In fact, we have received in the last 12 months so many inquiries from people who have heard about how safe places like Tapovan are, wanting to come, but also wanting to know whether there is a, if I have an aged parent coming, is there a assisted care facility available? We had to unfortunately turn away because we are not having the facility, nor we are qualified to say that we can provide you it is. The people who today have it are those who have engaged their own ayas independently. But I think there is a need even there to change that to a experienced person who can help these people out. So my request is that we invite you again to look at the option of setting up a geriatric facility. I know you're more into the palliative care. Because of the psychological reasons associated with the palliative care center in an environment like this, we don't want to look at that as yet. Maybe at a later date, but definitely an assisted living facility is the need of the hour. We have yes, more than enough place available in terms of beds to accommodate people. Not only some who are here already, but a lot of people who are calling for it. So I would like to request you to seriously think about joining hands with us and supporting us and helping the people. Having said this, I would like you to highlight for a couple of minutes what the benefits of assisted living are and what it entails, so that everybody here knows about it, because there are a lot of misconceptions, misunderstandings in all of us. So as a specialist who is handling it, we'd like to hear it from you. Thank you.
Okay, thank you so much. So as you rightly said, palliative is very different and assisted living is different. It's simple. From a geriatric population starts from 60 years. As we progress, all of us, it becomes like you become aged together. And when one particular person becomes a little more sick, becomes semi, independent. I would use the word semi-independent. Those are the times where you need a person to monitor or help and whatever it is. The other areas would be if there is a medical condition or if there is a post-surgical issue. Like assisted living need not be only a permanent factor. It could also be a temporary factor. I go in for a surgery, but my children are away. I have a wife or I have a spouse who's like, who can look after, be beside me, feed me and all. But, in terms of rehabilitating, I cannot, get her help. Then those are the times you can use, the assisted living, like where they will become an assistant to help you in the day-to-day daily living activities. That's what I mean by assisted living. An assistance for the daily living activities. Now, what is the extent? Again, it depends on person to person. Psychologically itself, they might just need a person around, just to take and give their medications. It could be something to that, or it can be up to their rehabilitation. That kind of a thing. Medically, what can be done in medicine is, of course, for people who monitor, who are like, very meticulous in monitoring their sugar levels, their BP, then being beside them, that is one category. The other thing is, who are completely, dependent on a caregiver, then that becomes a separate category. So this is precisely what it is. So medically, they need assistance and they need assistance for their daily living activity. This is what it is. It could be from the psychological perspective, supportive perspective, or it could be from the technical perspective. So it totally depends on the person. So that is what it is. So where I look at Tapovan, there are two ways of looking. Is one is you can have an hub, hub and spoke model is what I feel. Just you have one center where you have all these facilities, so the person can take an option, like say or surgery pandrom vechukongale, because we do get a lot of inquiry like that. எனக்கு வந்து plate மாத்திருக்கா, இல்ல they've done a ball and socket, or the person had a fracture, but that time they need something like that. Then you can have have the caregivers go to each one's residence, or you can have a medical center where they can come rehabilitate and go back, that kind of a thing. Right now I think that is what would be a right model. Of course we can create a team to a large extent. The question which was there and even now is whether you people want it only for Tapovan, or are you people okay for involving outsiders. Idu vandu of course ipa COVID nala that becomes a big questionable kind of a situation, because whether you're going to allow other people or not. So in the areas, if you all can have a large round of thinking, then that would definitely make sense. That's what I would like to put it at. I think, see, infrastructure is very easy, sir. What category of people what we want to put is exactly what I think we'll have to maybe take a small survey within the community, like what type level you want. Verum or aya level venuma illa nurse level venuma, and who can monitor. Definitely you'll need a physiotherapist in a team. You'll need a physical therapist. You might need a counselor. We might need a dietitian on and off, to just monitor how the well-being is, because these are the aspects in assisted living will definitely improve the quality of life of people.
Thank you, Doctor, for a detailed reply. This is part one of the two-part series of our discussion with Dr. Republica. The second part of this discussion will be published soon. Keep listening to Radio Tapovani.
உங்களிடமிருந்து விடைபெறுவது அனுசூயா. வாழ்ந்தோம், வாழ்கிறோம், வழிகாட்டுவோம்.